Buenos dias, Zamboanga! Welcome sa PIA Kapihan na Zamboanga sa SM City Mindpro. Hatid ng Philippine Information Agency, SM City Mindpro, MCTV, and E-Media. We are live at PIA Western Mindanao Facebook page and other government agencies' Facebook pages. That includes PRO9, and we are also live at Pagadian and Zamboanga del Sur Media. Also at ISA TV Channel 17, PCH Cable TV, and via cable televisions here in Zamboanga City at MCTV and E-Media. Ang Kapihan na Zamboanga po will discuss important topics that will help you make more informed decisions wherever you are. Again, welcome sa lahat po ng ating mga viewers and of course sa lahat po ng ating mga Barangay Information Officers Network here in Zamboanga City for always tuning in po sa ating programa. Ngayon po makakasama natin sa ating program from the PhilHealth Region 9 at we are very happy po to have them with us ngayong araw sa ating programa dahil isa-celebrate din nila ang kanilang anniversary. So let's welcome po yung ating mga bisita. We have Sir Philip Cataylo, the Public Relations Officer. We also have Sir Michael Jones Lahi, Public Relations Officer 3, Mr. Dr. Jacobo Maria Mendoza, Medical Specialist 4, and of course, Dr. Rosana Paraguya, their Medical Officer 7. So first po, we would like to hear your opening message. Baka po meron po tayong mga pa-welcome message po sa lahat po ng ating mga viewers.
Okay, buenos dias, mga bibientes de Zamboanga y de Region 9. We are really grateful that we are invited during this Kapihan sa Zamboanga as we celebrate our 31st year anniversary of PhilHealth. And this will be on February 14, 2026.
Alright, thank you very much po, Doc. No? Again, happy anniversary po. Pang ilang years na po natin?
31st year.
31st year. So, happy anniversary po sa ating PhilHealth family. And of course, we are very happy kasi nga PhilHealth and PIA are always in partnership, no? So, hindi na po natin patatagalin pa. Let's talk about the celebration of your anniversary. So, as we celebrate the PhilHealth's 31st anniversary, what is your most important message po to the public?
Well, yung message naman po namin is napakasimple lang po. PhilHealth naman is celebrating its 31st anniversary and it's on a heart month, February 14. So, we would like na the people will feel kung ano po talaga ang PhilHealth benefits. So, the theme for this 31st anniversary is kayakap ang Pilipino sa kalusugan sigurado. So we wanted na the benefits to be more felt by the people, by our members. So first, meron po kaming fast claims processing or fast claim payment. And then second, we have a stronger primary care through yakap. Ito po yung unang healthcare services. And then we have 3, the clear implementation of our no balance billing. So ito po yung sinasabi natin, tinitiyak po ng PhilHealth na mabilis, patas, at mapagkatiwalaan ang PhilHealth.
Okay. So you mentioned all your programs po, no, especially the payments, yung zero balance. Meron pong mga parang madalas na question, no? Hospitals and patients often ask po, how fast does PhilHealth pay now?
Well, that's a good question, no? In our policy, sinasabi natin na there's 60 days na dapat bayaran ng PhilHealth ang ating mga healthcare facilities. But from 40 to 60 days yung processing, binabaan natin to 22 days na lang ngayon. And hopefully, mapapababa pa natin some more, no? We'll try our best para pwede natin pababaan pa ng more than 22 days or less than 22 days yung ating processing time or turnaround time as we call it.
Okay, thank you, Doc. No? How does that help po yung ating mga patients directly?
O yung effect naman nito is better cash flow and yung ating mga facilities it will be a smooth operation, kung baga, no? Kung ang ating mga facilities ay hindi na sila mahihirapan, continuous yung kanilang pagbibigay ng health needs sa ating mga miyembro po.
Okay. Ito naman po, yes po, Doc. Do you have
To
additional?
add, napili po tayo among the 5 regions na magbabayad po ng daily na crediting daily sa hospitals o sa mga providers natin. So, to sustain yung services better. So,
Ano po tayo napasok doon sa 5, Doc?
yon. Ang maganda po doon kasi maganda po yung processing natin. So, lesser po yung, wala talagang backlog. Lesser po yung pending claims. So, among the 5 po tayo na pilot areas.
Yes po,
And ma'am,
sir.
to add no to what Dr. Paraguya said, why you asked na bakit Region 9 ang
oo.
pasok? Kasi with all humility, Dr. Paraguya's division, like one of the best performing divisions. So that's why we were chosen to be one of the pilot tests of this daily auto credit, ma'am.
So that's good news, no? Kasi that means kung maganda yung turnout, no, ng processing dito sa region, meaning mas mapapagaan din yung mga yung processing para sa mga miyembro din natin, sa mga beneficiaries. Ito po, what are you doing naman po, no, to reduce po yung ating mga denied claims and yung repeated po natin na back and forth requirements?
Yes po. It has been a national issue naman na marami tayong return claims or denied claims, no? And one of the solutions na binibigay natin is yung ating reach out. May reach out team tayo for Region 9 and nandito sila kasama namin. And we do have an open communication with the facility anytime they have problems. Tinatawagan namin kaagad, and we also do quarterly forum sa kanila. And kung gusto nila ng meeting, they can call us through our reach out and discuss yung ating mga problema regarding RTH and denied claims po.
Baka meron po tayong appeal, Doc, no, sa ating mga facilities para yung processing po nila becomes faster.
Yes po. Yung appeal po natin is to, sabi ko nga, maganda pag may 3 C's. Kung magsasubmit sila ng claim, dapat complete, dapat correct, and dapat consistent. So, correctly filed, completely filed, and consistently filed yung claims nila para hindi na po pabalik-balik sa kanila yung ating mga claims.
Thank you, Doc, no. Ito naman po, parati na natin tong nababanggit, natatanong itong about this topic, no. So, what should the public understand po talaga about the balance billing or the balance billing or no balance billing or zero balance billing?
Yes. Dati kasi limited lang yung NBB natin or no balance billing. Sa mga private facility, 90% of beds are dedicated para sa no balance billing and 10% for private, no, for paying. Sa private naman, we extended our no balance billing to 10% of their beds. So 10% of their beds, dapat no balance billing yun, and 90% are pay. What we want to remind our members is pag admission, sabihin nila sa basic sila or sa ward kung gusto nila, no? And try to remind the facilities to put on record na no balance billing sila at the start or at the admission para makater sa kanila yung 10% na bed capacity.
Thank you very much, Doc, for clarifying that, no. So sa lahat po ng ating mga beneficiaries, no, take note po of what Dr. Jacobo mentioned kapag po kayo ay magpapa-hospitalize or magpapa-admit for confinement. Yes po, Doc.
If sa private,
Oh, okay.
pag ward accommodation po yung pag ano po natin ng NBB. Pag sa private room, it's another story. So,
Klaro lang talaga.
iklaro lang natin
Yes.
na kung pupunta man ng private, talagang ang ano natin, no balance billing is more on the basic
ward.
ward accommodation.
Okay. So thank you very much, no, for clarifying that. This time naman po, let's talk about the yakap. So I remember, isa rin po kayo, si Sir Philip and si Doc Jacobo, yung nag-guest sa amin na when you launch the yakap program. So gusto po natin ulitin ito, no, na ito rin po yung ating highlight for our PhilHealth anniversary since we just launched this. So why is this our highlight for our PhilHealth anniversary? Yes, sir.
Okay. Yes, ma'am, no. Yung YAKAP or Yaman sa Kalusugan program, no, is the flagship program of a flagship primary program of PhilHealth, which provides free consultation to all Filipinos. That includes po yung diagnostic laboratory test and including cancer screening po.
Okay. So far, yes po, Doc.
Can I add? It's also the YAKAP program also will be the turn ng behavior ng Filipino on how to seek healthcare services.
Dati, ano lang ang PhilHealth, ang role niya is sa hospitalization lang. Pero ngayon, we want to change, sabi nga ni Doktora, ang health-seeking behavior natin from hospital lang to preventive. Gusto natin healthy ang mga Pinoy.
And to add, no, as what Dr. Mendoza said, yung we're more on a preventive side. So kasi sabi nga nila, prevention is better than cure.
Tama po, no? Hindi na natin kailangan hintayin pa na may nararamdaman na bago pa magpa-check up. This time, they will not be afraid to go seek for consultation dahil sakop na ito ng ating yakap ng PhilHealth. Since the launch po natin, meron na po ba tayong numbers of how many have benefited the yakap?
So, yes, ma'am. No, after Consulta was rebranded to YAKAP, ito in a national figure, no po. An additional 15 million availed the program. Tapos 35 million were registered in 2025. An additional of 16 million out of those registered underwent yung first patient encounter. Pero for Region 9 po, YAKAP performance exceeded target across all key indicators. Kasi we were able to utilize or reach the 125% po, ma'am, which translate to 739,408 beneficiaries who availed the YAKAP po.
And in addition to that, so we have a YAKAP facility in every municipality. So we have 71 municipalities, so lahat po yun may YAKAP facility. So as of the present, we have 161 YAKAP facilities, accredited YAKAP facilities, and 321 accredited YAKAP physicians.
Wow, napakarami. And parang magandang balita po din yon na all municipalities are covered. So hindi na po, wala nang rason, no, yung ating mga residents here in Zampen na dahil malayo sa kanila, hindi sila makapagpa-check up. That's good news na marami na tayong mga facilities and areas. May target pa po ba tayo for the year 2026, for this year?
Yes, yung target natin kasi we wanted to target at least half of the Filipino. So na-achieve na natin 35 million. Ngayon gusto natin i-achieve yung 55 million. So that is at least half of the population of the Philippines po.
That's for nationwide.
Yes, nationwide na yon. So, yun po. Paano po makaka-avail? Ito, para mas ma-achieve pa natin yung 55 million, let's encourage, no, yung everyone na hindi pa talaga or wala pa talagang idea or hindi pa nakakapag-avail. Paano po sila makakapag-avail?
Yes, laging ko nga sinasabi, no, sa ating mga kapwa Pilipino, no, 4M lang. Una-una, magpa-miyembro sa PhilHealth. Mag-register po kayo as PhilHealth member. Then make sure updated yung record nyo, magbayad ng contribution, then yung mag-avail ng benefits, yung pinakauna talaga yung YAKAP program natin. So paano natin ma-avail yan? Una, once registered na kayo sa PhilHealth at updated yung record nyo, pati yung bayad nyo, you have to assign yourselves to your preferred YAKAP provider. Kayo na bahala. Pwede nyo through our PhilHealth member portal online. Pwede rin sa eGov.ph Super App, yung pinaka-super app na ginagamit ng lahat ng mga government agency. Lahat na andyan na, mga frontline services natin. Or pwede kayong lumapit sa pinakamalapit na PhilHealth office. Pwede nga pati sa mga YAKAP providers, doon na rin kayong magpalista. So, there's no reason for any member na hindi makaka-avail or ma-assign sa preferred YAKAP provider. Kasi kahit saan, face-to-face or through online, napakadali na lang yung proseso po.
Why do we want to encourage our members, sir, no, to get checked para even if they feel fine? Kasi yun yung goal natin na magpa-check sila even if kahit wala silang nararamdaman. How can we encourage them?
Simple lang po. Kasi wag na natin hintayin na pagka lumala ang sakit, hindi lang ang sakit ang lalala dyan pati yung gastusin natin sa ospital. Lalala rin kasi kung huli na ang lahat. Pero as early as possible, pag wala pang nararamdaman, wala pang simptomas na lumalabas, pwede na kayo mag-avail ng PhilHealth benefits through the YAKA program. Ganun kaganda ng programa. At yung regular check-up, kung sabi ng doktor, kailangan ng further laboratory test, depende sa assessment po sa kanila, sa first patient encounter. Kasama na dyan yung nabanggit nga last year, yung yakap gamot na maaring ireseta po sa member natin at maaring ma-avail sa mga accredited na mga PhilHealth gamot pharmacies.
Okay. What common barriers po yung nakikita natin for the few months po na nagsimula yung yakap? Ano po yung mga common barriers po kung bakit marami pa rin or meron pa rin mga hindi nakakapag-avail?
There are two common barriers, ma'am. First is yung information barrier, and at the same time, yung second is yung system or clinic listing timing issues po.
Okay. Yes.
May I add? Kasi dito nga sa atin, ang dami nating dialects. So, yung namin is more on English and Tagalog. So, siguro, papunta na po kami na to make it possible na we'll print in different dialects. So, kasi may Chabacano, may Tagalog, may Bisaya, plus yung Muslim pa natin na may tatlong na Yakan, Tausug, Maranao, and Samal. Yun ba?
Kaya nga tuwing ini-invite po kami ng PIA, hindi talaga kami tumatanggi. Kasi especially itong platform, itong Kapihan na Zamboanga, is a very good platform para pwede natin ma-share yung programa ng PhilHealth. Hindi talaga kami tumatanggi niyan. This is a great opportunity. Besides that, malaking pondong binibigay rin ng ating national government for the information and dissemination campaign ng programs ng PhilHealth, especially YAKAP. So, kasama na dyan yung mga drive natin, yung mga radio programs, yung mga local health insurance office natin, yung YAKAP Caravan na ginagawa natin, mas ni-strengthen pa natin para, kasi andyan na, nakalatag na po yung mga 94% of mga localities natin meron ng YAKAP provider. Kailangan na lang ng mga member magpa-register or mag-assign sa kanilang sarili dyan sa mga YAKAP provider. So, yung mga rin na early ngayon, kanina lang nag-meeting kami, yung pre-procurement na meeting. Kasi nilalatag na namin yung schedule ng mga YAKAP Caravan ng mga local health insurance office para umikot kada barangay, kada municipality para mahirehistro na ating mga member dyan. So information is very important para ma-address natin itong barrier. At syempre, kasama namin yung PIA dyan.
Yes,
Yes,
we bring PhilHealth closer to the people.
Yes. That's a very good na initiative po, no, sir. You mentioned na any opportunity you can get to share to the public ay kinagrab natin para mas marami pa po talaga yung makarinig, makaalam about the program. With this naman po, no, we heard about the DRG-based global payments. What does it mean po in simpler terms?
Okay. Ang DRG, it means diagnosis-related groups. At the moment kasi, ang pagbayad natin ng ating mga benefits sa ating mga facilities ay case rates. So, ibig sabihin, yung choose whichever is mas malaki ang most resources used, yes. So, pipiliin lang natin. So, most of the time, isa lang yung binabayad nating diagnosis. What is nice about DRG or diagnosis-related group is kino-consider natin yung comorbidities and complications ng isang tao, yes. And not only that, kino-consider din natin yung demographics, if it's male, buntis, not male buntis, no? Female buntis, syempre. yung age ng tao, yes. And maganda kasi, for example, kung pneumonia, compared kung ang bata ay nagkaroon ng pneumonia and ang matanda nagkaroon ng pneumonia, kitong consider natin na ang matanda may comorbidities such as diabetes, hypertension. Yan ang kino-consider natin. Kaya mas maganda at mas precise ang pagbayad ng ating DRG. At the moment, we are still transitioning this DRG through our shadow billing and ESOA or Electronic Statement of Account. Kaya ang mga facilities natin, we are inviting or this is already
Enjoying, no?
enjoining kasi kailangan na talaga. Kasi kung hindi kayo magpapa-shadow billing and ESOA, hindi tayo magkakaroon ng DRG po.
Okay. Thank you po for giving us an idea of what is the DRG-based global payment. How does it help naman po with patients with multiple conditions?
Yes po. Through that, for now kasi yung binabayad natin, sabi ko nga kanina, isang diagnosis lang binabayad natin. But with DRG, we take into considerations the other comorbidities such as yung mga hypertension, diabetes, etc. O
Okay.
kung multiple yung kanilang mga diagnosis, we take into consideration those.
Thank you. Yes po, Doc.
Kung magkakaroon po ng, kung meron pong surgical procedure, pwede po din siyang mabayaran if we already go with the DRG program.
Okay, thank you po. Ito po ang aking next na question ay feeling ko po magugustuhan din talagang marinig ng ating mga miyembro ng PhilHealth. Is there a premium increase this 2026?
Yan, magandang question yan. Kasi based sa Universal Healthcare Act, there will be no more premium contribution increase, no, yung rates natin. Kasi we have already reached the legal maximum, which is 5% of our monthly income. Provided na meron yan mga income ceiling and income floor, pero hanggang 5% of our monthly income na lang. So instead, early this year, nung January, may press conference po si acting mahal na presidente, Ferdinand Bongbong Marcos Jr., na merong premium contribution amnesty, which is in connection po ito sa one-time waiver of interest and penalties na pinapatupad ng PhilHealth. So this is good news for our employers. Kaya nga magandang opportunity to clarify kung ano tong bagong pronouncement ng ating mahal na presidente. At sa mga succeeding interviews rin ng ating president ng PhilHealth, si Dr. Edwin Mercado, ay ni-clarify niya rin to ano tong bagong announcement po ng ating presidente.
Talagang magandang balita po yan dahil nga po sa pamahal na mga bilihin ngayon, di ba? Ano po yung message natin? What can we say to the members po worried about the affordability of our premium payments?
Yes, importante talaga to, no, kasi pamahal na lahat. And then yung mga gastusin natin sa hospital pamahal na pamahal. Pero ang PhilHealth nga is very affordable na nga tayo kasi compared sa mga private health insurance, 500 pesos lang yung pinakamababa na binabayaran ng ating mga members. Covered na yung primary member natin. Covered na yung asawa niya. Ang average na Filipino family per statistics is 500 pesos per month. Buong pamilya na kino-cover. Makakakabil ka na ng yakap program. Meron pa yung provisions ng PhilHealth gamot. Nag-expand pa tayo ng benefits ngayon from 30%, additional 50%, naging 95% na total. Mga rationalization ng benefits. At patuloy-patuloy pa yung mga expansion natin ng benefits. Yung nabanggit ka ni Doc Jacob kanina, yung transition natin from the all-case rate to the DRG na payment scheme, which is much mararamdaman ng bawat Pilipino ang PhilHealth, lalo na sa taong 2026. So,
Ayun.
maganda yan. At importante nito, sa premium contribution na through this new policy of PhilHealth na we invite our employers to pay their premium contributions regularly at i-settle yung mga missed contributions nila.
Yes, Doc.
In addition to that, for the middle class, yun yung talagang nagbabayad talaga palagi o continuously yung middle class. Meron po kaming in the pipeline na PhilHealth Plus. So, yun po yung tinitingnan natin na bago for the middle class.
Okay. So, aasahan po natin yan na yung mga future natin ng mga programs and services. Ito naman po tungo tayo sa one-time waiver. And sino po ang nakaka-benefit nito sa one-time waiver until when they can avail?
Yes, importante itong one-time waiver kasi ito yung sa mga, lalo na sa mga employers natin na hindi nakapagbayad ng mga premium contribution o yung mga missed premium contribution from July 2013 to December 2024. So, mga ano yan, mga employers yan natin, no? Then, mayroong mga existing pending request for waiver. Mayroong mga pending remaining surcharge sa mga penalties sa missed contribution at yung mga may current installment arrangement with PhilHealth. Ano bang ibig sabihin nito? Kasi ang PhilHealth, pagdating sa ating mga employers, kasi once ma-miss nila ang pagbayad ng premium contribution sa PhilHealth, nag-impose tayo ng mga surcharges or penalties, which is compounding pa. Habang tumatagal, mas nag-i-increase. Interest over interest yan. At meron tayong mga employers gusto i-settle, kaso lang masyadong malaki na yung interest rate para sa kanila. Hindi mahirapan na sila. So kaya nga, naiintindihan to ng ating mahal na presidente. At ang PhilHealth, kailangan rin natin yung pondo na makolekta kasi nag-expand nga tayo ng benefits. Kaya ni-impose natin itong bagong polisiya o waiver, basta bayaran nyo lang yung premium contribution in full, no? Mag-waiver tayo. In case na ganito nga, sabi natin hindi kaya in full, pwede 2 months to 6 months. May 1% surcharge lang, binabaan natin. At mga 7 to 12 months, so 2% surcharge sa buong mga miss na premium contribution na gusto nilang i-settle with us. Importante dito ay before mag-end ang year, no? Nilabas tong circular around January 9, 2025. So publish na siya sa Manila Standard, effective na siya noong January 24. So pwede na kayo lumapit sa pinakamalapit na PhilHealth office para to settle your missed premium contribution. Dapat before matapos yung December 31, 2026.
So wala na talagang interest, sir. Waive talaga siya.
Pagka provided, yan nga, ito yung catch, yung napaka-importante sa ating employers. Una-una, dapat lahat ng mga empleyado nila i-register nila or ipasok nila sa YAKA program ng PhilHealth. Then second, lahat ng empleyado nila dapat makapag first patient encounter. Then syempre, lumapit sila sa pinakamalapit na PhilHealth office para ma-generate yung ESOA or yung statement of account nila para yung validated magkano ba talaga yung missed premium contribution, yung surcharge. Then yun na, isabit lang nila sa pinakamalapit na PhilHealth office para ma-settle na po yung mga missed premium contribution.
Sir Philip, what happens if they don't follow the agreed payment schedule?
Pagka ganun, syempre sa totoong buhay, nangyayari talaga yan. Pinagbigyan na namin masyado ng kasi buwan nga ng puso ngayon, hindi naman heartless ang PhilHealth. Pinagbigyan na namin. Pero in real world cases, nangyayari talaga yan. So ibabalik natin yung dating surcharge nila. Kailangan nila isa-settle.
Okay. So yung previously paid interest po nila and surcharges, refundable?
Yung mga nakapagbayad na prior sa paglabas ng circular na to, hindi na namin i-refund yung nabayaran nila na surcharge. So yung mga hindi pa nakapagbayad starting this month hanggang December 31, so covered sila dito sa sa bagong policy ng PhilHealth.
Thank you for clarifying again. So for partner health facilities naman po natin, what's the key reminder on accreditation renewal?
For our accredited providers, so syempre meron po tayong deadline. Supposedly po yung deadline is January 14, 2026. Pero for the Yakap clinic providers, in-extend po namin yung deadline to January 31, 2026. And also, ang sabi nga namin, dapat pag mag-submit po sila, dapat kompleto na may DOH license, tapos kompleto yung documents attached, and andun yung mga signatures.
After January 31, Doc, wala na po. Hindi
Meron
na sila.
pa rin, pero re-accreditation na yung tawag namin. So, may mga miss na po. So, yung mga may gap, hindi na po yun mababayaran if ever meron pong claim. So yun yung magiging negative sa kanila kasi hindi namin po mabayaran ang claim kung may gap.
Okay. So, usually po pag ganyan, where can the facilities ask for assistance?
Regarding application,
The accreditation?
yung sa accreditation naman, since October po ng 2025, nagsesend na po talaga kami ng letters reminding the providers for their renewal of their accreditation comes the first month of the year. So it's always January of the year.
Thank you very much, Doc. So, yun po yung paalala natin sa mga accredited facilities natin. No? So, please take note of the dates para hindi po tayo mahuli sa ating mga submissions. Wala pong delays and dapat complete na rin po yung ating mga requirements. This one po, no, tungo tayo sa ibang katanungan on the focusing on the catastrophic conditions. Why po?
Alam naman natin na yung mga catastrophic conditions ay very debilitating sa ating mga miyembro. Every time na ma-hospital tayo ay kailangan maghiram ng pera, magsanla and everything. And one thing we saw, PhilHealth saw, is dapat pwede nating i-contain itong mga gastusin na to. In Region 9, meron tayong mga samples, no? And we already have Z benefits in some of our institutions. Sa ating Zamboanga City Medical Center, nagkikater na tayo ng breast CA na package cost up to 1.5 million yun. We also have acute lymphocytic leukemia, we have surgical and prostate cancer, and yung Z-Morph and implants sa Zamboanga City Medical Center. We also have kidney transplant dito sa Ciudad Medical, and itong bago lang, we have angioplasty dito sa Zamboanga Peninsula Medical Center. So, pati yung mga na-improve din natin, yung mga catastrophic cases such as chronic kidney disease through our hemodialysis naman.
Thank you very much, Doc. Ito po, additional question na lang po no, on our transparency and digitalization. Ano po yung ginagawa ng PhilHealth about this? And how is fraud control being strengthened din po as we go to digitalization?
Yes, this is part of the, hindi lang PhilHealth, lahat ng ahensya ng gobyerno. Yan tayong direction natin, digitalization. At part dito, yung ating presidente, Dr. Edwin Mercado, have already talks with mga IT professionals and agency, also with the help of the ICT to utilize yung AI na technology to madaling makita yung mga fraudulent na mga claims. So, iba na yung PhilHealth ngayon. Gamitin na natin AI, andyan na yan, at gustong-gusto yan ng ating presidente. At ito yung part ng ang mga safeguards ng PhilHealth to be, di lang tayo responsive sa pagbayad ng ng benefits sa members natin, pati na rin sa pagbayad natin, meron na tayong nilalagay yung safeguard para masinop tayo sa pag-release ng mga ating mga benepisyo sa ating membro at walang kalokohan ng nagaganap.
Yes, sir.
And to add sa fraud prevention po, our legal office po sa Regional Office 9 and the other legal offices of PhilHealth po, we usually conduct domiciliary visits to healthcare institution. Okay. Okay. Okay na po. Okay. Yeah, as what I have said, no, to help prevent fraud po, our legal offices po conducts domiciliary visits to healthcare institution just to check if there is indeed availment of this benefit package. Kasi we want to safeguard our funds for those who need it in the near future po.
Thank you very much po. Yes, Doc.
To add lang, we also have aside from our legal services, we also have office dedicated for monitoring yung ACRE, and also in my office sa benefits administration. Nagbo-monitor kami, we do pre-authorizations, we do pre-validations, and sometimes yung system natin dinidetect na nila if something is red flag coming from the claims of our healthcare facilities. Kaya ina-encourage din natin, do not do fraud na lang para hindi mahuli.
Thank you very much po. Okay.
Yeah. In addition to that, we do conduct the medical prepayment and even medical post-review of different claims.
Okay. So with that po, thank you very much. No? Marami po tayong natackle na topics, marami pong mga concerns and programs and services po ng PhilHealth. And again, we would like to ask kung baka may mga mensahe pa po tayo sa lahat po ng ating mga miyembro, lalong-lalo na po ngayong kakabagong taon lang po natin for 2026, and of course, for the anniversary celebration. Yes, Doc?
For our members, PhilHealth members, tinitiyak po ng PhilHealth na isang PhilHealth na mabilis, patas, at mapagkatiwalaan sa mga serbisyong sa ilalim ng Universal Healthcare Act. So, ang sabi nga natin, mabilis dahil paspas el pagada del mga claims el hospital, and then patas husto mejor na serbisyo tiene kita konpiyansa kay sigurado el aton salud with PhilHealth.
Okay. Yes po, Sir
I
Michael.
would like to, first things first, I would like to thank Ma'am Myra and PIA for being a good partner of PhilHealth. So would like to take this opportunity to urge our members to update their records po. You can visit our local health insurance offices. So we have 4 in the region: Zamboanga City, Pagadian, Ipil, and Dipolog. And here in Zamboanga, we also have our express site. And at the same time po, we have lined up activities for our 31st anniversary. So on February 12, all our media partners, including PIA, we will have our press conference at Astoria Hotel. Then it's a long weekend on the 14th.
1 week.
On the 14th, our anniversary. Dr. Paraguya is our chairperson of our PhilHealth anniversary committee. So we will have a motorcade, Doc, a mass first, to give thanks for our 31st year, and thereafter we will have a motorcade together with our healthcare facilities po.
Anymore? Yes po.
So we are enjoining everybody to join us on our anniversary, our 31st anniversary. Pwede po kayong magbisita sa different LEOs para po ma-update, or if you have issues or concerns, then visit our LEO office po sa mga panahong yon.
Thank you. Yes, Sir Philip.
Yes, kaya nga yung PhilHealth nga, yung anniversary ng PhilHealth, eksakto February 14, because we were created February 14, 1995. Kaya yung
Puno ng pagmamahal,
puno ng
sir.
pagmamahal. Kaya yun rin sa mga employers natin, puno ng pagmamahal ang PhilHealth para sa inyo. Take advantage nyo na yung bagong policy, yung one-time waiver for yung mga surcharges and penalties. So, lumapit na sa pinakamalapit na PhilHealth office, settle na yung miss premium contribution nyo para hindi nyo na babayaran yung mga surcharges and penalties, provided na make sure i-register nyo po yung mga empleyado nyo sa YAKAP at magkaroon ng first patient encounter. Adyan po si Sir Alan Ramos. Lapitan nyo lang talaga siya. Yung pinaka-pogi namin dyan sa collection section.
In addition, pahabol, meron po kaming flexibility, yung flexi claims, since yung mga beyond na 60 days or 120 days na pag-submit ng claims, na deny po yun noon. So, ngayon po, meron kaming flexi claim na program, sinasabi natin yung from 2018 to December 2024. pwede po kayong resubmit ng claim na yon hanggang March 2026 na lang po. So, para po mabayaran yung claim if found na complete po yan.
Thank you very much po muli sa lahat po ng ating mga panauhin ngayong araw. Thank you very much po sa ating mga guests from the PhilHealth Region 9. Thank you po. Maraming salamat. And of course, baka i-greet po natin ang lahat ng
Happy Valentine's Day! And for our PhilHealth colleagues, Happy
Happy
31st
Anniversary.
Anniversary PhilHealth!
Happy anniversary po and happy Valentine's Day. Gaya po ng sabi natin, talagang February 14 yung PhilHealth anniversary dahil puno po ng pagmamahal at malasakit po no para sa kalusugan po ng lahat ng Pilipino ang PhilHealth. Maraming salamat muli. Once again, we have Dr. Rosana Paraguya, Medical Officer 7, Dr. Jacobo Maria Mendoza, Medical Officer 4, Michael Jones Lahi, Public Relations Officer 3, and Philip Cataylo, Public Relations Officer. Muli, maraming salamat po sa ating mga panauhin and thank you very much to all our viewers. Thank you to Barangay Information Officers Network. Makikita pa po tayo sa ating mga susunod pang episodes ng Kapihan na Zamboanga sa SMC Mindpro. Sa ngalan po muli ng PIA Director General Catherine Chloe De Castro and PIA Regional Director Ms. Noemi Edaga, ito si Myra Espinosa. Muchísimas gracias.
Philippine Information Agency, Kapihan na Zamboanga. Sharing with you timely, accurate, and relevant information regarding government programs, projects, and activities. Catch us every Thursday at 4 p.m. on eMedia.